Soundbites from Vet Advantage. This soundbite is sponsored by WG Critical Care, LLC, and focuses on Quartermaster Suspension, penicillin dihydrostreptomycin in oil, FDA approved for intramammary use to reduce the frequency of existing infection and to prevent new infections with Staphylococcus aureus in dry cows. This video supports the Quartermaster Suspension SoundByte Tear-Out published recently in Vet Advantage magazine. Dialog boxes at the bottom of page 2 assist in quickly aligning discussion with the customer's knowledge or perception of Quartermaster suspension. Confidently position Quartermaster by starting with having Quartermaster suspension available again for dry cow mastitis control and prevention may be useful for milk producers and their herds. Let's review this dry cow tube and its availability, so you can determine whether to bring Quartermaster suspension back into your protocols for cows during dry-off. The easy-to-view information on page 1 quickly illustrates the features, functions, and benefits of Quartermaster suspension. For example, Quartermaster suspension features a 10 milliliter intramammary tube containing a combination of penicillin and dihydrostreptomycin in oil. The benefits include bovine mastitis prevention and control in dry cows, reduced frequency of existing infection, and prevention of new Staphylococcus aureus infections in dry cows. The flexible tip system allows insertion of the full cannula or a 1/8 inch section of the cannula into the teat canal. Full and/or partial insertion meets the recommendations of the National Mastitis Council. Quartermaster has a 40-year track record, 150 million treatments and counting. The benefit is strong brand recognition with receptive customers who utilize mastitis tubes. Quartermaster suspension also provides the benefit of proven efficacy for today's dairy production methods as evidenced in a 2013 study. And the low cost of Quartermaster suspension compared to other prescription tubes means greater savings for milk producers. The top of page 2 presents the different NDS numbers and packaging for Quartermaster suspension carton and Quartermaster suspension pail. Important safety information. Quartermaster suspension safety information. Indications: intramammary use to reduce the frequency of existing infection and to prevent new infections with Staphylococcus aureus in dry cows. Limitations: not to be used within 6 weeks of freshening. Not for use in lactating cows. Milk taken from animals within 96 hours, 8 milkings, after calving must not be used for food. Animals infused with this drug must not be slaughtered for food within 60 days from the time of infusion, nor within 96 hours after calving. Federal law restricts this drug to use by or on the order of a licensed veterinarian. Ingredients: each 10 milliliters of suspension contains 1 million units of procaine penicillin G and 1 gram of dihydrostreptomycin base as dihydrostreptomycin sulfate. Thank you for taking time to discover the reasons why Quartermaster suspension is the mastitis treatment trusted for decades by dairymen and their veterinarians. For more information, visit www.quartermaster-rx.com or contact your WG Critical Care, LLC sales representative.